people build careers, very few people build institutions, and fewer still build institutions that continue serving people long after the founder is no longer there. That is the distinction that drives everything I am doing on this journey. Day 22 of documenting my rise as a global health and wealth architect. And today I want to share the most personal and architectural part of this vision. What a health legacy in Africa actually looks like. What I am building, how I am building it. And why I believe the next generation of African health leaders must think in institutions, not just in careers. Why legacy thinking changes everything in healthcare. Let me ask you a question that most medical training never asks. When you retire, when you step back from your clinical practice, what remains? For most doctors, the honest answer is nothing structural. The patients they served must find another doctor. The knowledge they accumulated stays largely in their head. The relationships they built dissolve with their departure. A career, however brilliant, is personal. It is attached to one person, and when that person steps away, the career ends with them. An institution is different. An institution has structure, systems, protocols, trained people, a mission that exists independently of any single individual. An institution serves patients who were born after its founder retired. An institution trains doctors who never met its founder. An institution influences policy in rooms its founder never entered. When I think about my health legacy in Africa, I am not thinking about how many patients I personally treat. I am thinking about what I build that continues treating patients long after I am gone. The 4 pillars of my African health legacy blueprint. Let me share the 4 pillars of the institutional legacy I am building toward in Africa. Pillar 1, the DPC network. A network of direct primary care practices across key African communities, beginning in Ghana. Each one serving 300 to 500 families with a dedicated physician, an integrated community health worker program, and the telemedicine layer for remote monitoring. Not one clinic, a network, replicable, scalable, built on a model that proves itself locally before expanding regionally. Pillar 2, the training institution. Every DPC practice in the network becomes a training site, educating the next generation of family medicine specialists in the principles of continuous relationship-based preventive primary care. Africa has a severe shortage of family medicine specialists. Building the DPC network without building the training infrastructure to sustain it is building on sand. The training institution is what ensures the network outlives its founders. Pillar 3, the policy advocacy platform. DPC as a model does not currently exist in the regulatory frameworks of most African nations. Changing that requires sustained, credible, evidence-based policy advocacy at ministerial and parliamentary level. The academic credentials I am building toward, including Harvard, are not personal achievements in isolation. They are the credibility infrastructure required to walk into health ministries and make the policy case for DPC with authority that cannot be dismissed. Pillar 4, the research agenda. Every DPC practice in the network generates data, patient outcomes, cost comparisons, preventive health results, community health impact measurements. That data, rigorously collected, analyzed, and published, builds the evidence base that justifies expanding DPC policy across Africa. research turns clinical practice into institutional knowledge. And institutional knowledge outlasts any individual practitioner. What I am doing right now to build this legacy. The vision I just described is not a 10-year plan that begins after Harvard. It is already in motion. MG Consultas in Brazil is the proof of concept. Every day I practice the DPC principles I intend to build into the African network. I am learning what works, what needs refinement, what the patient experience of genuine, continuous care actually produces. This YouTube channel is the public intellectual foundation of the legacy, building the voice, the credibility, and the audience that the policy advocacy will need. The LinkedIn presence is the professional network, connecting me to the policymakers, researchers, funders, and collaborators that no institution can be built without. The Harvard preparation is the academic infrastructure, the research skills, the policy frameworks, and the global health network that the evidence-based advocacy will require. Every piece is connected. Every action today is a brick in the institution that serves Africa tomorrow. This is not a side project. This is the central project, and every other part of my professional life, clinical, entrepreneurial, academic, digital, is in service of it. A word to every African health leader watching this. If you are a doctor, nurse, health entrepreneur, or public health professional in Africa, and you are watching this, I want to ask you directly, what institution are you building? Not what career are you pursuing? Not what salary are you targeting? Not what title are you working toward? What institution are you building that will serve your community after you are no longer there? Because Africa does not have a shortage of talented health professionals. It has a shortage of health professionals who think institutionally, who look at a broken system and hear not a complaint, but design brief, who see a gap in primary care and ask not who should fix it, but how do I design the fix myself? You may be a young doctor in Accra or Lagos or Nairobi or Kampala or Dar es Salaam, and the institution Africa needs most, the clinic, the training center, the research platform, the policy advocacy body, may be waiting for you to stop thinking about your career and start thinking about your legacy. The world does not need more impressive CVs from African health professionals. It needs more African health professionals building impressive institutions. Start today. Start small, but start with the end in mind. An institution that outlasts you. If this planted a seed, share it with one African health professional in your network who is ready to think beyond their career. Day 23 tomorrow. The Faith-funded clinic. Subscribe. Comment below. What institution are you called to build in Africa? Name it. Write it in the comments. Let us witness it together.